intelligent clinical trial matching based on your disease and symptoms. Let's click on here. Once we've signed up, we now have ways on the left that we can search for particular studies if we have more specific ideas, but the power of CancerBot is for you to just describe yourself and your disease, and we will find you relevant trials. So we can see below here we have 7 eligible trials, because we don't know that much about me as a patient right now. And then we have 121 potential trials. So let's just start describing ourselves a bit more and see how this adds. You can see just entering my age. Now I suddenly have 86 relevant trials. I can enter my gender. Maybe I say I'm female. And then I can add weight. Now we're still at 86. If I add weight, go ahead and do this in pounds. And then let's do this in inches. And then we'll say 65 inches. Enter ethnicity. This is actually used to compute normal levels of things like creatinine. And we can enter blood pressure. And we can enter the country. I'm going to leave it as US. We can enter the zip code, which we can use for distance matching. We enter the disease. Today we just support multiple myeloma and follicular lymphoma because we have very specific sets of information that we get for the different diseases. I'm going to leave it at multiple myeloma. We enter the stage. This is actually going to make a big difference. You can actually see the definitions of stage are provided here. You probably already know the stage, but we do have the definitions provided for stage 1 to 3 for multiple myeloma. Let's go ahead and say we are stage 1. We have different performance scores, Karnofsky performance score and ECOG performance status, which are very important to establishing just what our level of disease is. Let's go ahead and say that we are ECOG performance status 1, so restricted and physically strenuous activity. We say whether or not we have other malignancies. We say no. You can see we're down to just about everything is eligible now. Let's go ahead and click on potential. You can see that if we only enter our M protein levels, we in fact will be eligible for all of the things, for all of the trials. So at this point, we can start scrolling through the trials, looking through what the recruiting status of the trial is, the location, a summary of the intervention and treatment. So as I go through here, this looks intriguing. Low-dose radiotherapy and treating painful bone metastases in patients with multiple myeloma. And you can see that we have a full description then, and you can see we have various criteria, the minimum age, the consent capability, the ECOG performance status, the Karnofsky performance score, and the fact that we're not pregnant. These are all determined as criteria. If we decide that we are interested in this, we can then click on apply, and then all of our information will be sent to the researcher.